Good afternoon. Thank you so much for participating in today's webinar. This webinar is the third in the 2016 Winter Webinar Series, 21st Century Student-Centered School Nursing. Today the topic is care coordination. What does it mean and how do you do it? The panelist for today is Dr. Marty Engelke, a professor at East Carolina University, College of Nursing. Thank you, Marty. We have a great conversation ahead of us today, so let's get started.
Thank you, Margaret. I'm really pleased to be here today and to share what I know about care coordination and to really share with you some thoughts about how case management, and I'm going to talk about this, care coordination are similar and different, and then hopefully we're going to really talk about some pragmatic issues about how you get started, how you implement, and how you evaluate school nurse care coordination. And then as someone who's interested in education, I really want to integrate some of the evidence that we have about school nurse care coordination. Just a little bit about myself. I was involved in a project in North Carolina for about 5 years. I was the project director, and we implemented a model of what we called case management at the time, and had several nurses in different, I think we had about 21 counties in North Carolina that implemented that program, and we were able to measure our outcomes, and it was really, I think, a very positive experience for a lot of us. So I'm hopeful in that I can integrate some of the lessons that we learned from that project. So before we get started, you're probably even thinking right now about, okay, now what is she talking about? Case management, care coordination, are they the same thing? Are they the same thing? Are they different? How are they similar and how are they different? So we thought we'd do this poll. Sharon will initiate the poll and give you just an opportunity to talk, to give us some thought about whether you are doing case management or care coordination now, or you aren't doing it. And so I'm going to ask Sharon to launch that poll, and we'll take about 20 seconds for you to answer it, and then we'll move on from there. Okay, let's go ahead and close the poll, and Sharon, if you can share the results with us.
Yes, Marty, the results are showing on the screen now. I'm not sure if you can see them because you're in the presentation mode.
Okay.
They are on the screen. We have 43% that tell us they sometimes do care coordination for a few students. 31% say that it is a major part of what they do. 18% tell us they are not providing direct care. 5% are not quite sure. And 3% do not have care coordination as part of their role.
Okay. Well, that's great. That helps. That gives me an idea, and it sounds like we have kind of a variation between those of you who are pretty experienced and those of you who maybe are thinking about it but not doing it right now. So I want to just say a few things about what you're going to find if you look in the literature is that a lot of people use these terms interchangeably. I think originally a lot of the work that was done in school nursing was called case management, but I think the broader term now is care coordination. And what I think care coordination reflects is the idea that we are not just looking within the school for a specific student, but that care coordination is broader and includes coordination with other partners. So I'm going to use the term care coordination mainly because I think that's more consistent with some of the recent things that NASN has done. There's this definition that they have here of care coordination. What I think is really exciting about the role of care coordinator for the school nurse is that it's really based on the full scope of nursing practice. And I think that's really relevant because I know sometimes I've had lots of school nurses say to me that they aren't able to completely function within their full scope of practice because of competing demands and other priorities. So I think this role of care coordinator is really important. The other thing that I think is important about care coordination is that it really comes out of a community-based public health model. And for someone who has worked in only an inpatient setting, although care coordination is certainly very, very relevant to inpatient settings, but some of the things that are thought to be part of community-based care coordination are a little bit different than what we might see in a hospital-based program. So I think that just as this framework that NASN has provided for us, I was really pleased when I saw this because I think that it really demonstrates the central role of nurse care coordination, that it's really all about helping students, and that it really is embedded in the standards of practice for school nursing. And as I said, when you're functioning at the top of your game and really implementing all of the standards of practice, I think that's really one of the most rewarding roles for a school nurse. So I want to begin. I've got a list of references at the end of the presentation, and but this was a review that was done by McClanahan and Weismiller in 2015 and was published recently in the Journal of School Nursing. They did a systematic review of articles that related to school nurse care coordination. Sometimes the name in the article was case management, but they included those. And what they really found in looking at all those articles were these four things: collaboration, communication, clinical expertise, and continuous coordination. And they went on further to say that a real central part of care coordination is the whole idea of care planning and the nursing process. And they end the article with a model that I think is really helpful, and I would recommend this article to you if you're really trying to think through the different pieces of what care coordination might look like in your school district, because I think it's a really helpful synthesis of the whole concept. And I'm going to touch on all of these as we go through the presentation today. So, as I said, I'm an educator, and probably all of you remember from your days of nursing school that nothing happens without the nursing process. And I think care coordination is really an application of the nursing process. So we're going to talk about how you can maybe assess students, those that might be in need of care coordination, how you might develop goals and interventions related to those students, and then how you might evaluate not just an individual student, but an entire program that you might have on care coordination. I'm going to take a break between these sections, so if you do have questions, let us know, and if not, then I'll take questions at the end. But I do hope that this can be somewhat interactive so that we can learn together, because it sounds like we have some experienced people on the call who maybe can add some information to what I'm presenting. So First of all, I want to talk about what really I think is important in school nurse case management um, as opposed to other models of care coordination. I think what the school nurse is really focusing on, and the overarching goal, is helping students to self-manage their illness at the highest possible level. I think that is really the main thing that school nurses are good at. I think that by doing that, the school nurse is in a key position to help a student who has a chronic illness grow into a productive, happy adult where they are managing their illness rather than their illness managing them. And that, I think, is really critical. Some models of care coordination you'll see from different groups. They talk about saving money. They may talk about efficiency of care. And while all those things are important, I really think that it's important, just like that initial model that NASN provides, our real focus and the center of what care coordination is, I think, for the school nurse, is that it's all about the student and it's all about helping them self-manage their illness at the highest possible level that they can. So I want to start with some questions because I really think that before you start, it's important to have a good idea of what you're getting into and also being able to build support for what you want to do. One of the questions that I think is really important is what your nurse-to-student ratio is. And I know that from my own experience that varies considerably across different school districts. Everything from having a school nurse in every school to a school nurse who maybe has to cover 4 or 5 schools. So that is going to have a big impact, one, if you can do care coordination, and 2, how you're going to implement it. I think it's really kind of difficult if you're only in a school, say, once a week or less. It's really often becomes difficult, and I've had school nurses say that to me, that they really can only provide care coordination to a limited number of students, because if they're only there 1 day a week, they are often putting out fires. So it becomes difficult to really provide care coordination. The other 2 things are, I think, also very important. I think that you want to have a conversation early on about whether or not you have a policy related to care coordination. And by that, I don't mean a lengthy policy, but even something as simple that affirms the role of care coordination as part of the school health program in the district, and a definition of what that's going to mean. When we did our project, we developed a memorandum of understanding with the superintendent of each school district that participated. And that became really important in some school districts where the principal had different levels of support for care coordination and that role that the school nurse could play in care coordination. So I really think that it's worth it to take the time to get all of the key players on board and to be sure that everybody is in support of it. And then also that the job description of the school nurse includes this. This isn't a concept that's just unique to nursing. There are social workers, there are other school counselors and other people whose professional role might include care coordination. So I think it's really important to clarify how the role of the nurse is related to those other potential care coordinators, and that it's really important to know which students might really need a nurse for care coordination. Typically, it's the student with chronic health problems, and the social worker or counselor often, and it can be a very collaborative relationship. If the student has a lot of other kinds of needs that are more social needs, it can be a great collaboration, but I think you have to get that set initially. The other thing that I think why this is important is that I remember a particular school nurse who said to me that part of when she started doing this, it changed her whole orientation to the school day. And so before she really tried to do care coordination, she was usually in the office, and people knew she was in her office, and so she did a lot of things like you know, watching after students that maybe were disruptive in the classroom. And so the fact that she was always there sort of reinforced that she would be there to do that. And when she started doing care coordination, she realized that she needed a different model, that she had to be outside of the office, because to meet with students often meant that she had to find out when they were available. And so initially that was a transition, not just for her, but for the other people that she worked with in the school. And so it was helpful ahead of time for everybody to know that this was going to be occurring, because I think you can see that could be a lot of misinterpretation, like, you know, what happened to the school nurse? She's not in her office. Where is she? So I think it's really important that this gets straightened out early on in the care coordination implementation phase. So some other things that I think are important are for you to think about. Again, this goes back to staffing levels and the amount of time that you have, but how is what you're going to do as a care coordinator different from crisis management? And are there different levels of care coordination that you might be providing? For example, some programs have different levels. They have intensive care coordination, where the goal is that the school nurse is going to meet with that student at least weekly, if not more often, because they're really working with the student that has a lot of need, that really needs a lot of reinforcement, and that really there's a lot of things to be prevented in addition to the things that the school nurse is treating. So in some schools they have that intensive level, and then they have a less intensive level, which is just that this is a student who maybe was in crisis at one point in time, but everything's in place and things are working well now, and so the role of the school nurse is just to ensure that that continues, and you may not meet with the student on a daily or weekly basis. You might just touch base with them every couple of weeks, especially if you're not in the school every day. The other thing that I think is important is, you know, we really want to focus on something that we can measure, and I think there's two types of tracking that affect what your care coordination program will look like. One is how you internally track what you do every day as a school nurse. Many school districts have gone to an electronic system where they have a database, and I know that some of the databases allow you to include certain outcomes related to care coordination, and that's great, but some nurses don't have that. It's really just still a paper and pencil type of record keeping. So you have to really think about then how you might be able to track your outcomes, whether it's with an Excel spreadsheet or something that allows you to see what you're actually doing and what you're actually achieving. The other thing that has a big impact on the kind of care coordination you'll provide is whether you have access to the electronic health record that is a part of that student's care from the medical provider or the hospital or other care providers. I know that, and this was on the NASN forum, about the webinar that the National Association of Chronic Diseases did, which was specific to the electronic health record. And there were 3 examples of places in Wisconsin and Oregon and Delaware where the school nurse did have access to that electronic health record, and certainly that just changes the whole idea of what you can do and what you're able to provide and what you have access to. So then the final kind of, before you're ready to take off, is to think about how you're going to integrate this into the day, how you might get family buy-in, and then kind of setting a level of care coordination and a target number of students. I've talked a little bit about this already. I know from my experience it's very difficult to be a care coordinator at the beginning of the school year when you're inundated with everything, and so you may need to think about that and when your care coordination might actually be offered during the school year, and also how you might integrate that into the school day. As I said, a lot of school nurses really had to be creative in the way that they could be more involved with students. As far as family, one of the things we did was send home a note at the beginning. I think it's helpful to get the family on board early on so that they know who you are, they know how to get a hold of you, and they can contact you if they have any questions or concerns. And as I said, I think it's better to start small and have maybe a smaller target number to begin with, and then to let your program grow, because I think that I know we thought in terms of 5 students, and I think that that's a more experienced nurse could certainly do more than that, but a lot depends again on your setting. So as far as the next thing I want to talk about is how do you decide, and there's been some research on this, and typically what the school nurse depends on are referrals, either because a student is visiting the school nurse frequently, they get a referral from a teacher or a parent or a healthcare provider, something new that has occurred, and then I think school districts typically have a yearly health survey that they use to get information that might identify students who need care coordination. But I think it's also important, and I'll talk a little bit more about this later, those are good sources of data, but there's also, I think it's important to look a little bit further. This was a study that compared a survey that was done with students who had asthma, and then compared it to who the school nurse was actually providing care coordination to, and there was some discrepancy in the two, that students who really had some significant asthma symptoms, still they weren't being coordinated by the school nurse, and it was usually because the school nurse didn't know that they had a problem. And I think you as school nurses can probably think about a lot of situations where either the parent doesn't report it, or for you're not there frequently enough that you don't know about a particular student who might need care coordination. So some other ways, I think that certainly through assessment of the student, students that are having problems, where you know if you have access to the electronic health record or a referral from the primary care provider, that they're clinically they're not being well controlled, that their diabetes or asthma or whatever it might be isn't being managed well. You know, a situation where you have medications but they're not being either provided or being taken regularly. All of these kinds of things, I think, can be useful in identifying a student that might need school nurse care coordination. Another thing that I think can be very useful, the idea of academic indicators, but I would just say we found there's a lot of students with that need help who actually do pretty well in school. They are still, their grades are not really affected, at least yet. Absences are one of those things I'll talk about later. One of the issues that's really difficult sometimes with using absences as an indicator is that an awful lot of school districts don't categorize absences as health-related or non-health-related. In other words, if you go to the front office and try to see who's been absent a lot lately, you don't know if it's because they're missing the bus, they went to Disneyland, or if they really their asthma is flaring up and they're having to stay home. So these can be really useful, but I think again you have to really look at them within the whole picture. This is probably, to me, the real slide that shows the majority of kids who are going to need care coordination. This slide, to me, is reflective of what we see in schools today, is that a chronic illness is put upon top of the fact that the student doesn't have enough to eat and doesn't maybe have health insurance or a regular primary care provider. And so I think these often can even be more important than the issue of severity of the illness or the actual diagnosis, because these students who are carrying all this other baggage with them are often the ones who have difficulty with managing their illness. So, starting out, I think it's important to think about what your goals might be. And just a few comments about goals. I think they need to be individualized, and they need to be something you can track, because I think that, again, we're trying to be able to show that what we're doing with care coordination is really making a difference. And so I'm going to give a couple examples. These are the categories that we used, and I'll be honest, I think we had too many goals and too many interventions that we tried to track, and I'm going to talk about the pros and cons of those. But I think that probably the one that is really the most important, that I know school nurses are really involved with, are trying to make the school environment safe for a student with chronic illness. And they're called different things in different places, but emergency action plans and individual health plans are critical, I think, and really promote safety when they're used and when they're easily accessible. In other words, where that emergency action plan and that health plan and the teaching that that you've done for teachers and care providers kind of provides a safety net for that student, that whether they're on the bus, in the classroom, or on a field trip, that the people who are with that student know what to do in case of an emergency. So I think that while I've heard school nurses talk about, this is a big part of what they do. It can be somewhat burdensome at times. It's really, I think, important to frame this in the way that in the overall objective of these things, which is to have a safe school environment for these students, because I think safety is really something that's high on everybody's mind when we talk about the school environment. So symptom management, this is something that I think is often specific to the illness. I would say that, and again, you may choose the type of students you may choose to provide care coordination to. If the two most common are usually asthma and diabetes, and so you might have a very specific thing that you can track that has to do with the school and things that hopefully wouldn't happen at school that maybe had been happening before you got involved. So this may also be a particular goal that you might have for a student with a particular illness. This part, the self-management goal, as I said, I really think this is what's critical for school nurse care coordination. There are some indicators that you can have for any student. For example, any student who you're providing care coordination to, you would, I think, have the goal that they would be able to manage their illness better, that they would be able to describe their illness and be able to make good choices. What's helpful about these general indicators is when we talk about evaluation, you can kind of sum these across several diagnoses, and I think that can be very helpful. But again, if they're so general, they may not be they may not give a really good picture about students with particular illnesses. So you might want to combine those with things like being able to use an inhaler, an EpiPen, or administer their own insulin. So again, I think you need probably both of these. You probably don't want more than a couple under each of these, because again, you're trying to think about things that you can manage when it comes to tracking these things. So that, again, when I'm a big believer in evaluation, because I think that if you have a great program, but you can't actually provide some data to show that what you're doing makes a difference, then it isn't going to help you to sustain the program. So I've mentioned academic success. As I said, it's interesting. If you're going to look at this, then you need to figure out how you're going to measure it so that you can know what health-related absences are. The reason I think, as I said, these goals need to be individualized is that you will have students who are getting all A's and B's, even though they seem to have a difficult time managing their illness, and probably at the end, if you've made that your main goal, you may not see improvement because they were already doing okay. But for the student who's struggling academically because their illness is getting in the way, and they're missing school and they're not in the classroom as long as they need to be, then this might be a real appropriate goal where you could perhaps, I know we did this in our project, we were able to compare the goals, to compare the grades the year before the school nurse was involved to the year that the school nurse was involved, and did find that for students who were performing poorly, the school nurse really made a difference. But if the student was already doing well, then fortunately that was sustained, but it didn't improve anymore. Another set of goals I think might relate to the family, and I'll talk a little bit about our own findings about what really made a difference to students. I think that, and I know that all of you as school nurses know that the family is key to how well a student does with their illness. I remember one school nurse who said that her main goal in this section was that the mom would not dodge her phone calls. And she actually achieved that goal because by the end of the school year, the mother was actually initiating phone calls to her. And I thought that was a great example and also a great success story, because it really, as I said previously, this whole idea of having a family who isn't real supportive of the student certainly makes it more difficult for the school nurse to have an impact. Okay, and then here we get into the part about, again, for the student who's going to the emergency department frequently for their illness or has a lot of visits to their primary care provider or doesn't have a primary care provider, some of your goals for that person might be related to helping to improve healthcare coordination. Again, tracking of this is a lot easier if you've got access to the electronic health record. But I think that also I've known school nurses who've been able to track this within the school system mainly by talking to the student and also the counselor and the family members. So the part here about helping with a primary care provider and getting health insurance, I think is critical. I think this is really the public health or community health aspect of care coordination, because without those two things, it's really an uphill battle getting the proper management of a student with chronic illness. So the next thing I want to talk about is interventions. I again have these general categories, and I think that school nurses do all of these things. I do think in care coordination it's more about education and counseling and hopefully moving less towards direct care. But if you're fortunate to have one school, you may provide a lot more direct care than someone who's covering 2 or 3 different schools. So again, being able to track, thinking about what you need to do to be able to track and what you can track for an individual student, and how you might be able to document what it is that you are doing. We were fortunate when we did our project. We had a secure website at the university that the nurses logged into, and it could just be a lot of different checks. From our perspective, that was great. For the school nurse, it did often mean if they did have access to an electronic record that they were documenting more than once. So again, I think you have to look at what you can document based on the kinds of resources that you have available to you. These categories, I mean, I think that also these general categories, it might be that you really can structure your intervention according to these categories so that you can then look at what you've done in relationship to not just direct care and education, but what kind of services you've provided to teachers and to families, and then the healthcare coordination piece, which I think is is critical, and I know that school nurses spend an awful lot of time doing that, but it's often kind of undocumented time that they don't always have a good way of tracking all the phone calls, referrals, assistance that they've provided with improving healthcare coordination. So I do think that's an important area to try to track your interventions. So this slide again is a research study. A lot of what I've been talking about so far is what you do, but this particular study was a review of some qualitative studies. What I think is important is it's not just what you're doing, but how you're doing it. And these helpful interventions, these are students that identified these interventions, is the whole idea that your approach in care coordination with the student is helping them to see that there is a future and that there is a sense of hope, and that the school nurse is really the person who can help them, as I said, manage their illness rather than letting the illness overshadow everything that they do. So I think this is, again, it's in your reference list, and I think it's important for us to think about not just what we're doing, but how we're doing it. So I'm going to move into evaluation. This is coming up a little blurry on my screen, but this is, someone who has probably done a really good job, but doesn't have the data to support what it is that they did that was successful. So evaluation, to me, is about looking at outcomes. And usually we have a couple of different types of outcomes that we can think about. We can think about quantitative outcomes, which are going to be things like numbers, the percentage of goals you've achieved, and then qualitative outcomes, which are more related to stories. And I think both of those are really important. I'm going to give a couple of examples of each of those. And I do think it's important to track a few outcomes well, rather than a lot of outcomes that you're not able to track. So I'm going to move into this section of the presentation. I wanted to stop just a minute and ask Margaret, is there anything that you think I need to address at this point in terms of, I can't see the question, so is there anything that you think before I get into evaluation that I might need to address?
And Marty, this is Sharon. I'm just giving Margaret access to those questions now.
Oh, okay, okay. Well, let me continue then for a few minutes. And Margaret, if there's something, just feel free to, to interrupt me, and I'll be glad to address them. Because I've kind of covered what I think are the nuts and bolts of care coordination. What I really want to talk about now is, because I think that, as I said, I think this is such an important area for school nurses, and I think that in order to be able to be successful in sustaining your program, we need data to be able to convince people, because this does add, I mean, I think you can't do this if you don't have an adequate number of nurses in the school system. So I want to talk about providing data to different stakeholders on and some things that might be useful. So in terms of the students and looking at individual students, I've kind of addressed this a little bit. If you have a certain number of goals that you have decided are a part of your care coordination program, and the nurse assesses that those goals were met for 80% of the students, then I think that's a positive outcome. I think that, and that's one thing we talked a lot about, you will never be 100% successful with all of the goals you might have in care coordination. But if you're, if you're achieving the majority of them, if students are better at managing their illness, If parents are more responsive, if the student is feeling more integrated within the school system, then I think that those are things that are important. We used a little short quality of life measure that we did at the beginning and the end of our project, basically just asking the student a few questions about how they felt about their illness, whether they felt it limited them physically or academically or socially. We used a specific quality of life measure that has been used a lot in pediatrics, but I think that other people have used that particular instrument or they've used something that they've developed themselves. Certainly as an educator, you know, somebody who does research, it's best to have reliable and valid instruments, but I think you also have to put that within the context of what's realistic in the school setting. Ours was just a few items. It's called the Pediatric Quality of Life Instrument, and there's a specific one for asthma and diabetes. And the nurse would, if the student couldn't do it themselves, the nurse helped them with that, and if they could do it themselves, then they did it themselves. So that's one way of thinking about student outcomes. Clinical indicators, I know in working with a lot of school nurses, some people have access to this information, some people don't have access to this information. The other thing that I think is important about clinical indicators is that not all clinical indicators are just school nurse sensitive. And what I mean by that is that you have to really think about, for example, hemoglobin A1C. It may be related to the fact that the school nurse is providing care coordination, but it may also be related to the fact that the student, you know, finally got a care provider who maybe is an endocrinologist and had a better understanding of how to help them control their diabetes. So I do think it's important, you know, if you're looking at clinical indicators, to be sure that you have access to them. And then a caveat is also that a lot of clinical indicators, they're influenced by really the whole healthcare team, not just the school nurse. And the same is true for academic type indicators, is that, you know, the type of educational, if a student has gotten involved in a different kind of educational program or a counseling program, we always have to be we have to be a bit careful about that and think about what is it that is sensitive to what the nurse actually did. So I'm going to talk a little bit about, these are just some things that how we represented our qualitative and our quantitative data related to students and parents. This is just a comment, but I've used this several times because I really think it shows the influence of the school nurse. I mean, this student had a long-standing problem with remembering his seizure medicine, and it really was the influence of the school nurse and not wanting to disappoint the school nurse that it really made a difference in the other outcomes. But without this, we might not have known when we looked at things like the number of seizures at school that it really was related to the influence of the school nurse. This is another one, and I'm going to talk a little bit more about mothers and fathers and caretakers. I think they can be the best allies for helping to sell your care coordination program. This is just, I've abbreviated it a little bit, but really I think makes it very clear about what the nurse did that helped not only this student, but this family be able to handle this new diagnosis at school. And as I said, I could share other stories of where really parents become the best advocate for care coordination for the school nurse. So this is quantitative. This is something that comes out of an article that I wrote with two of my collaborators. This is, I think, helpful when you're thinking about disseminating to the larger population of people that are interested. One of the things that I put this up because I know most school nurses don't have access to a statistician, but what I want to just put in a plug for academic and school nurse partnerships, because this has been something, when I originally started my original project, the third author on this was a regional school nurse consultant in my area, and we wrote that grant together to get funded. And now I'm working with a wonderful school nurse as a consultant to her school district in North Carolina to help evaluate her program. And what certainly I can't add the expertise of a school nurse in the sense of knowing the day-to-day things that a school nurse needs to do, but what I think people in academic settings have are access to things like statisticians and databases and things like that. So I put this up again just to go back to this whole idea. This was when we looked at our data with asthma. The kids who had an improvement in GPA, these were kids who needed, who had low GPAs. These were some of our goals, and it was really, if you look at this, it's really, certainly the school nurse, it was important for him or her to help reduce the episodes of respiratory distress, but it was really when the family got on board and when the utilization of the primary health care provider improved, where there also was an improvement in GPA. So I really think, I mean, this is just our project. It's certainly not generalizable to every project, but I think that it does demonstrate that this is something that is important, not just to, as the relationship between the nurse and the student, but also the other care providers in the family. Whoop. And one of the things that we did as a part of our project was just a very brief survey. As I said, we had a little letter that went home at the beginning and told the family that the school nurse would be working with their student or their child this school year, and asked them for any suggestions and gave them contact information. And then we just asked a couple questions about how well the family felt that the students managed their illness. And then we repeated that at the end of the school year. And it was interesting because we did find a relationship. Those school nurses that were able to be more involved with the family, there was, the family actually provided data to say that the child was better at managing their illness. So it just helps to bolster the opinion of the school nurse that things are better when you have corroboration from the family and also the teachers. And we did a similar thing with, and I know that some students have a lot of teachers, so we had to kind of make a decision about, depending on the level, whether it was an elementary or middle or high school student, which teacher might be the best to approach for a particular student. But again, it was really about letting the students know that we would be involved and that the school nurse would be providing this, and asking for feedback and also asking for suggestions, and then getting the teachers involved in actually the whether or not it had made a difference. And then I've kind of said this before, if you have a way of measuring or surveying the primary care provider. I think that's often a really helpful piece of information when community partners recognize the importance of the school nurse. And as I said, helping the project I'm working on now, it's been pretty interesting to see the nurses, how effective they are in helping to secure care for students in the school system that don't have care for one or another. The last thing that the economics is really, I think, the hardest, because most of us don't have a health economist on staff, and because it's kind of hard to do this. I don't know if you're familiar. This isn't specifically on care coordination or case management, but it has that tone because they looked at the amount of time that was saved by teachers and also parents, how having a school nurse provided providing care, how it saved those folks time. This was a collaboration between CDC and the nurses in Massachusetts, and also NASN. Erin Mon is the research director at NASN. But I think that this is important to at least think about. I know we're struggling with this right now. This particular study, there was a school nurse in every school, as I remember, and this becomes, I think, even more complicated when you think about when the nurse is not in the school every day. But again, these are things that maybe on a limited basis you can think about in terms of the amount of time that you save parents and teachers, parents who don't have to, less time. What happens often when the school nurse isn't present is that the parent gets a call, and if the parent is working, they have to take off work. And I think what happens when the school nurse is there, when the school nurse is the care coordinator, that we do see a decrease in that kind of thing because everybody is on board in how to manage a situation with a particular student, and so there isn't this need for the student to miss school. So what I think, just to summarize, and then we'll go ahead and see if there are some questions, I do think that school nurse care coordination really helps to promote quality, it promotes safety, and it really, the school nurse, we've all heard it over and over again, that school nurses have more contact than any other health professional with school-age children. And sometimes they're the only health professional that a school-aged child sees. So I think that this is just critical for school nurses to be involved in, and that they can really have an impact on the health and well-being of students. And then it's really consistent with nursing. I think the clinical expertise of nurses combined with our emphasis on holistic patient-centered care is really what makes us a really natural for this role of a care coordinator. So in closing, this is a quote from a school nurse. I think because I want to also make the point that I think this helps students and it helps families, but it also helps school nurses. I've just heard so many wonderful stories from school nurses who feel like when they started doing this, when they started doing care coordination, it really improved their job satisfaction because they can really see where they've made a difference to students. I remember a couple of school nurses who not only did care coordination on an individual basis, but a lot of what they provided was in groups, because so often kids, school can be pretty cliquish, and you know your clique, but you don't know other people in your school who maybe have asthma or have diabetes. And so I remember one school nurse who talked about her satisfaction. She started a club called Coming Out with Diabetes, and really was about helping the students in the school who had diabetes know each other, but then also helping their peers not to be afraid of someone who had diabetes, and what to do if their friend had, or even an acquaintance had a problem with their blood sugar. I think those are the kinds of things that school nurses like to do, and I think that by really doing them and being recognized from doing them, I think that can provide a lot of job satisfaction. And so I think that's it. That's about all I have to say, and I have a reference list. This is, I hope nobody feels like this after listening to me talk for this long, but if you're still with me and still listening, I'd be glad to entertain any questions.
Thank you, Marty. There were a couple of questions and comments, but we'll share those with you and give you the opportunity to review them after the webinar.
Okay, perfect. Okay, great. All right. And here are my references, and I think that's it.
Well, thank you so much, Marty, for this wonderful and very informative discussion about care coordination. What does it mean, and how do you do it? All attendees will receive an email with a link to the slide deck and recording. And one final note is NASSEN's annual conference will be here before you know it, NASSEN 2016, Learning, Linking, Leading. So start planning now to attend NASSEN 2016 in Indianapolis, Indiana by setting aside time to attend. Visit nassen.org/NASSEN 2016 to access the Attendance Justification Toolkit. This is Margaret Salucci, NASSEN's Director of Communications, and on behalf of NASN, thank you so much for joining us today.